Earlier this week, President Barack Obama signed into law historic health care reform legislation.
Sunday night, the U.S. House of Representatives passed the Healthcare and Education Affordability Reconciliation Act 219 to 212. Monday, the president signed the bill. Thursday, the Senate gave their final approval.
This bill has far-reaching implications across the country and especially for college students, including those right here at CalU. The two biggest changes include increased federal funding for students and longer health care options.
College students will see increases to their federal Pell Grants beginning in 2013. The grant will increase from $5,550 to $5,975. Borrowing money will now become easier as students will now be able to get a loan for college directly from the government. Overall, $13.5 billion will be set aside for increased funding. The bill also allows dependents to stay on their parents' health care plan through their 26th birthday. There are other reforms in place of the bill, but many of those will not be taking effect until 2014. CUTV spoke with students on campus to get their reaction to the passing of the Healthcare and Education Reform Bill. Some students were happy with the changes, others, though, aren't sure exactly what the details of the bill mean to them.
A lot of things that people are saying about this healthcare bill, but I think it's definitely a change, and it could be something that could benefit us in the long run. As far as healthcare, it could definitely benefit the Americans.
I don't agree with it just because I don't think it's going to really benefit our country at all. Some countries have it, it's not really benefiting them that well. So
I support it to an extent. Everybody deserves to have coverage in healthcare, but it's going to have problems. People are going to go to the hospital for very unessential issues, little things, and it's going to cause longer waits. And we should have learned from Europe's problems not to pass it. But it has its ups and downs.
I think it's all right. I'm interested to see what it's going to do. I'm not one to follow on this too much, but I haven't really seen any flaws with it so far, and it should be interesting to see how it gives the health care to people.
I think it's a good step for the reform and universal health care and stuff. I think it's a good step towards that way. And I would like to see that you will go to the hospital for any reason. And if, let's say you break your fingers cut off or whatever, you go to the hospital and it'll be reattached for free.
I want to receive free health insurance and dental insurance and all insurance for free and not have to get a job to have insurance.
I'd like to see, myself, of course, get health coverage if I ever get sick. Of course, possibly my children if I ever have any, etc.
Well, if it is passed, then I'd like to just see that it works as well as they're planning it to work, and that it doesn't hurt our country at all more than it already might. So that's just what I think about it.
Despite public disagreements, the passing votes came from the Senate earlier today. The final vote was 56-43 in favor of the bill.